Now, we recently published a paper on a few of these patients, 12 patients and 8 controls, and we looked at the immunoreactivity to monoclonal and polyclonal antibodies against HERVs in these duodenal biopsies. And on top in A, B, C, D, you see the immunoreactivity to anti-HERV for 4 different types of HERVs. And here you see the controls. You see the 8 people. These were 8 people that were referred to the gastroenterologist for other complaints that were not having any CFS symptoms. And as you can see, there is clearly an immunoreactivity against HERVs in these patients, and not in the controls. In this, you see that the immunoreactivity to rat, SFFV envelope, and goat anti-MLV gag antibodies is positive in the patients and is not positive in the controls. And you can see that the morphology of the cells, which we show here, is different in ME/CFS patients from controls. Now, what are these cells? It took a while to find out what these cells were, but they are CD303 positive. So they are plasma dendritic cells. They are plasma dendritic cells that move from the plasma to the tissue for some reason and start spitting out first. So I'm not making any conclusions at this time. We have evidence now that ME/CFS patients are developing some kind of autoimmune disease after a while. And you can say it's only 12 patients and 8 controls, but in the meantime I have data on 400 patients, and it stays 75% to 80% who have this lymphoplasmatic infiltration in their stomach and in their duodenum, which you never find in normal people or in non-autoimmune disease. This is not exclusive probably to ME/CFS. It's been described in other diseases like MS, but these diseases are defined as autoimmune diseases. Now, one last thing, we are developing a new test, a macrophage activity test. As you can see, we are doing this right now, and we are in fact measuring activity of macrophages on top of the nagalase, and that will give us more information of how the system is dysregulated. So I think I'll stop here, and I think we then still have time for questions. Thank you.
Dr. de Meirleir, thank you. That was a very impressive presentation. I think you have described the biological findings about autism in and out. I remember to a society in the United States that treats Lyme-induced autism. Many of the kids diagnosed with autism did not have autism as such. They had neurological Lyme. One of the very important points that I think you have realized, you have touched, is about the several infections and co-infections that these kids are presenting. In this case, I do assume that Gcmaf can be a great finding and supporting their immunological system in order to be able to respond to these. If the nagalase stops the sugars from binding and promoting the vitamin D receptors, are you supplementing your patients with something like ambrotose or, for example, galactose?
No, we're not. No. I don't think there's, I mean, that's all very nice in an experimental setting, but in a clinical setting, there's not much real published arguments to do that. So there's always a difference if you do an experiment and people don't pay for things and they're really an experiment, or people are in a clinical setting where you just show data from the clinical setting. There's a big difference between both of these things. So there's certain things we certainly don't do if we don't have any published proof of it. Well, I mean,
do you see the same thing, or you don't
he's saying the same thing. I think it has to do with all these co-infections. That you are activating your macrophages double-sided, in fact. They're two different systems. So I think the more infections you have, the more cytokine reaction you can have. I think it's the spore to stay under the threshold to overactivate. Because the way macrophages are stimulated by LBS and by Gcmaf is different. It's clearly different, and I think there is competition, but I think when there's a really multiple infections, like 4 or 5 different infections, like he has these very ill patients. I have some too. It's like 5 to 10% of the total group, but he mainly specializes in the severely ill with the Karnofsky 40-50. We are now also looking at the PRCPs and the HERVs in these children, because there was, in fact, the topic I wanted to talk about, but I didn't have enough data yet, on mothers with children, mothers with CFS and children with, and there's clearly a genetic link, and there's clearly an environmental and infectious link, but that's very difficult to study. You'll have to have whole families, but in my total practice I have more than 300 families now, where there's mother and daughter or son, and I also have like 50 now, where there's 3 generations. And in Norway I have one family of 28 people. They're all sick and all have autoimmune diseases. It's not only autism and BCS.
Thank you very much, Dr.